So the disease that I had was for tuberous sclerosis. And my protein sequence encoded for tuberin isoform 1. I've also included the pi-mole color code here so that it is easy to identify helixes, sheets, and loops. This is the pi-mole image of my protein in the original format. Here we can see the X and Z axis of my protein. And here we can see the Y axis of my protein. So the gene responsible for producing the tuberin isoform protein is tuberous sclerosis complex 2, TSC2 for short. A similar gene, tuberous sclerosis complex 1, TSC1, is responsible for producing the protein hemaritin. Tuberin and hemaritin are both tumor suppressors. Tumor suppressors cover a wide range of proteins, which help to regulate the division and growth of cells. Mainly, they help to regulate any irregularity in cell growth and cell division. Together, tuberin and hemaritin help to regulate cell size and cell growth. In order to explain what tuberin does, I feel as though it is necessary to explain how hemaritin also works, as these two proteins coincide to regulate cell growth and cell proliferation. So this is the tuberin pathway, and I'll walk us through this. Here we can see hemaritin and tuberin working side by side. This then moves on to Reb, which actually stands for RAS homolog enriched in brain. It's a GTP binding protein, which activates mTOR. mTOR, which stands for mammalian target of rapamycin, will then directly phosphorylate transcription factors. And transcription factors initiate and are responsible for protein synthesis and cell growth. To sum up, this whole chemical process is essential to the cell cycle, cell regulation, cell growth, and cell proliferation. I'll now begin to walk you through this next diagram, which really just helps to enhance everything we've covered. TSC1, hemaritin, and TSC2, tuberin, are two proteins that coincide to regulate the two TOR complexes, TORC1 and TORC2. Together, the TSC1 and TSC2 will actually negatively regulate TORC1 through its GT-PACE activating protein, GAP. GAPs are a group of regulatory proteins that primarily bind to activated G proteins to stimulate the GT-PACE activity. GT-PACEs function as molecular switches in regulating fundamental cellular processes. Specifically here, we're looking at cellular growth and cellular division. The GAP's role is to actually turn off the G protein's activity through binding of GTP. GAP will allow the G protein to be available for nucleophilic attack by water, which will then induce a GDP-like charge distribution. In short, the TSC1 TSC2 complex will limit cell growth in response to poor growth conditions. By doing so, they avoid downstream health issues, including tumor development. So TSC2 is a wonderful gene, encoding for tuberin protein, and this helps to carry out very important cell regulatory processes. But what happens when this gene encounters mutations? We end up with tuberous sclerosis, or, and I'm going to try to say this, lymphangioliomyomatosis, or LAM for short, which is much easier to pronounce. Here we can see the TSC1 and the TSC2 gene in regards to tuberous sclerosis. LAM can be caused by mutations in either TSC1 or TSC2 genes. People with LAM can experience a range of adverse effects, such as coughing, wheezing, chest pain, shortness of breath, and even lung collapse. LAM can occur either independently or can coincide with tuberous sclerosis complex. And this is why I felt it was necessary to go into both the TSC1 and TSC2 genes, because oftentimes we see these two mutations in these two diseases together. It is believed that isolated LAM is caused by a mutation occurring in the TSC2 gene early in development. Because of the mutation occurring early on, some cells may have the mutated version of the gene, while other cells may have the normal version of the gene. This specific situation is referred to as mosaicism. I'd also like to take a moment to point out that LAM is most common in women and also most common in women of the childbearing age, and this is of great concern. This table is showing the LOH, which stands for loss of heterozygosity in the different chromosomal regions for the TSC2 gene. Here we can see several swaps between amino acids, primarily glycine, threonine, and alanine, which leads to either incomplete or irregular sequences. This is shown to be true in 60% of TSC-associated angiomyolopias. Angiomyolopias are tumors containing epithelioid cells, which are cells found surrounding blood vessels. The swapping of amino acids destructs the protein so that it is no longer able to detect poor growth conditions and limit cell growth. Downstream, this leads to tumors throughout the body, which then leads to a cocktail of negative health effects. Unfortunately, I was not able to show where these specific mutations take place in my protein using PyMol because the CHP model was only able to generate a tertiary structure that matched 31% of my sequence. These mutations take place in my sequence earlier than where my tertiary structure begins. However, with some digging, I was able to find this model that does depict the amino acid swapping that leads to the mutations at hand. I won't go into detail with this figure as it would take up a lot of time, but I have included the citation on this and the previous slide for those of you who are interested in looking further into this specific study. It does hold a lot of really valuable and very interesting information. It is important that while LAM is mainly connected to a mutation occurring in TSC1, tuberous sclerosis can arise from a mutation occurring in either TSC1 or TSC2. When these proteins function properly, they're able to activate mTOR, which then regulates the translation of multiple proteins, many of which are responsible for cell regulatory factors that we've mentioned previously. When this mutation occurs, mTOR is not activated, and these factors go unchecked, leading to development of tumors and lesions. So tuberous sclerosis is a genetic disorder, and that's characterized by the growth of benign tumors throughout the body. Main areas that we see this are the brain, skin, kidneys, and other organs. It's a rare genetic disorder that can be apparent at birth or can arise later in life. This image shows both the TSC1 and TSC2 gene structures. To the right-hand side, we see bar graphs depicting the total percentage of mutations for each exon. In TSC1, exon 15 is the primary point of mutation, whereas in TSC2, we see the highest percentage of mutations occurring on exon 33. And I do apologize, I did try to get this image to be bigger, but then it began to get blurry, and you really couldn't see clearly these structures, which I felt was really important. So I also found a story of a patient who has LAM, and she talks about being symptomatic and assuming that she had asthma. She talks about being diagnosed, about having to hear that there's no cure for this, and also about how she's changed her lifestyle. I'm going to try to share this. and see if this works.
A show with a lesson in perseverance and why it's important to pay attention to any small changes in your body.
Being active has always been important to Megan Rizbicki.
It just makes you feel good and get outside and then enjoy it when you can. Weekend snowboarding trips, go for a hike. We used to go biking, you go on a jog, whatever it may be.
But a few years ago, Megan found herself struggling to match the pace of her friends on those adventures.
I was snowboarding in the wintertime, having a hard time keeping up with the rest of my friends, even though we were all just as fit as one another. Having a hard time breathing, coughing a lot. So there's multiple signs that started years before my diagnosis.
Concerned, Megan headed to the doctor.
I knew it was something. There was no mistaking it was something. And I was 29 years old. It was terrifying. It was very scary.
Doctors initially thought she had asthma, but a CAT scan revealed something else: Lamb lung disease.
LAM, or lymphangioliomyomatosis, is a rare lung disease that afflicts almost exclusively women. It involves many cysts in the lungs, or sort of air pockets surrounded by a thin wall that start to fill the normal lung tissue that can impair a person's ability to breathe well. Moderate to severe, and I say that based upon your pulmonary tests. It can cause low oxygen levels and impair someone's quality of life and ability to exercise and participate in normal daily activities.
I was pretty numb. It happened so fast. It's hard to understand it at the time. There was a lot of emotion, but I tried to stay as level-headed as I could.
A CAT scan is going to be the only firm clue towards that diagnosis. They can develop this milky fluid in the space around the lung, and that milky fluid can cause a person to feel even more short of breath.
Doctors first helped Megan get involved in a drug trial, which was the first step towards her future.
The good news with that drug was that it did stabilize my lungs.
She had been started on this medication that also reduced the amount of fluid that was building up around her lungs to slow the decline of lung function.
Megan was also encouraged to stay active and use oxygen to help her do so.
I think exercise is super important for these patients. It might not make your oxygen requirements less, but it will help you feel better endurance, better quality of life.
A lot of times you'll see me walking around with my oxygen on. If it's anything more than just walking around the yard, I just try to be as active as I can. It's not something that's going to make me sit on the couch and do nothing all day long. Definitely getting out there and doing as much as I can.
She feels a lot better now. She's been able to stabilize her symptoms. She needs less oxygen than she did before. And my hope in anyone who has lung disease, and specifically in someone with LAM, even if it's getting more severe, is to stay active, to participate in life, do the things that you enjoy doing.
Megan says the final key to managing is a positive attitude.
There's still so many things I can do. There is, and I'm very lucky. It's important to me that I just keep doing the things that I can do, and even pushing myself. I don't want it to consume me.
She now hopes to inspire others living with LAM not to give up on what they love to do.
Taking care of your body as much as you possibly can, and making that the priority, and doing the best to manage it to be as healthy as you possibly can, to enjoy, again, the abilities that you do have and take advantage of them and use them. Make it a good, fun life.
All right, so that was my patient video that I had found regarding LAM. And you can see that this was a more positive video, which I enjoyed. She has a good outcome with it. Although there's no cure for this, she's trying to live the most enhanced life that she can. And then this is my works cited page where I have a number of references which have been cited throughout the slideshow and will also be cited on my paper. Thank you.